Hello, class. My name is Michael Murray, currently enrolled in Nursing 674 in Grand Canyon University under Dr. Sarah Gabwa. Today, I will present my practicum project that was conducted on Vitas Healthcare, the leading hospice care agency nationwide. My practicum project is about nursing documentation on hospice patients on how it affects patient experience towards hospice. First, I want to identify the objectives of this presentation. The objective of the project is to discuss the challenges of documentation for hospice care, how it affects it on direct patient care, and what are the alternatives that the company can provide. We also want to identify areas to improve hospice care documentation and how it promotes positive patient experience. Lastly, we want to know what are the future action or implications of the project that is initiated by the Vitas company to remain as the leading hospice care provider. The project was conducted on one of the Vitas program in Southern California, particularly in Riverside County. It is numbered as Program 92, and Vitas is consists of several programs across 14 states and the District of Columbia, which houses more than 10,000 caring employees nationwide. They remained as the number one hospice agency due to several factors. One is they are a large company that caters hospice patients nationwide, and most importantly, they have their own set of standards that exceeds state guidelines such as continuity of care. My preceptor was Miss Helene Luck, and she serves as the patient care administrator for the program, and she's responsible on clinical operations within the area, including nursing care, supply budget, and hiring potential clinical team member. She is educated with master's degree in nursing and a registered public health nurse on the state of California. The practicum project is about improvement of hospice documentation. Elevating standard of nursing documentation will lead to several positive results such as improved patient care time, improved nursing efficiency, and real-time documentation reviews. Next one is the needs assessment results. The need assessment will assist on identifying current conditions and desired outcomes. The needs assessment results of the project are the following. Nurses and other healthcare workers documentation may be inaccurate, especially if the company started to use paperless documentation, or we call it digital documentation, and may result to negative impact to patient care. Secondly, improvement of hospice documentation will assist the company to support Medicare hospice services requirement for appropriateness of the patient bills to be appropriately bill the insurance. The goals of the project is to provide quality and excellent nursing hospice documentation that will reflect positively on overall experience of patient to the hospice care, and to meet the minimum standard of Medicare regarding hospice documentation that will justify patients' eligibility to the service. The project outcome that is clear during the implementation is the Vitas healthcare team will start to implement digital or paperless documentation for field nurses. This innovation will support team members to be more efficient, effective, and more focused on patient care. Transitioning to digital documentation will lead the team to effectively deliver hospice care. Training and implementation will start this month of July 2023. The resources needed to effectively implement the project is to provide additional smartphones, tablets, and intensive training for field staff. Stakeholders of the project includes patients and their families, field staff members, especially nurses, and senior management team that includes general manager, patient care administrator, team manager, and the corporate team. Positive feedback from the stakeholders are observed, such as improved time for patient care. Patient families notice that visiting nurses are more focused on their nursing care rather than documenting while on bedside. The efficiency of nurses has also improved by spending less time on documenting with the help of technology and new systems. The senior management are also able to review interventions and findings from field staff by reviewing notes in real time via new system. Although although positive outcomes are more evident during project implementation, there are few barriers or resistance identified during the project implementation. One is seasoned nurses, hospice nurses that are used to do manual charting are facing challenges and difficulty to adapt with the new system. To resolve the issue, the company provides intensive training and additional resources to all team members and made sure that everybody have adequate knowledge before implementing the new system. Another barrier is that the lack of resources available with such lack of resources available such as smartphone and tablets to all team members. With more than 10,000 clinicians needing new tablets and smartphones, the company needs to spend millions of dollars to successfully provide each team member their the need of smartphones. Project sustainability will be effective through intensive training regarding new system, quarterly training and digital documentation to ensure quality and reliability of information, and continuous update and improvement of the system by the IT department. My reflection on the project leads to the realization that documentation on hospice setting is as much as important as the patient care because it shows the nurse's work by looking on his or her notes. Another reflection that I realize is the handling of pressure between patients' interests versus companies' interest. Vitas is for-profit organization and sometimes it pushes nurses to do less quality of care so that the company would benefit from it in the long run. However, as a nurse, we must uphold and advocate for the patient's interests so that we can provide the best possible care that they deserve. Lastly, strong clinical team can always justify the cost of care and advocate for patients' interest. My personal reflection while conducting this project is a realization that project implementation is relevant to every healthcare setting so that patient care will be improved and areas to focus on will be addressed. I also noticed that Vita's healthcare takes pride in providing quality hospice care by providing multiple RN visits that are more knowledgeable on symptom management. Thank you for listening to my presentation. Congratulations to all of us, and God bless us always.